And one of the things that I just wanted to remind people is that as the oldest family planning organization in the country, we see 2.5 million women and men every year in our health centers in every county, in every state in the country. We have 650 health centers around, and our Planned Parenthood represents 22 counties in southwest and central Florida. And we saw over 65,000 patient visits last year in our area, and thank you, it was wonderful. And in those health centers, we actually are operating 11, soon to be 12, up and down the southwest coast and into the Orlando area. So we're immensely proud of the work that we do and know that people are really standing tall with Planned Parenthood now. The theme of our event this evening switched from a celebration of the 100th year anniversary to "We Won't Go Back." And that is why we're all here tonight, right? Because we are not going back. We are going to fight hard to maintain Planned Parenthood services, family planning services in this country. And because of the enthusiasm of the people in our area, we are feeling very strong and secure and supported, particularly in a room like this. Not the case in Tallahassee, unfortunately, particularly with our elected officials from our area. We have, unfortunately, some of the most conservative legislators who've been elected this term, and both Senator Greg Steube and Representative Joe Gruters have filed very anti-woman bills this year. And so it's really important that we all get in touch with them, and we're going to do that a little bit later in the program inside. The other thing that's really important now, as you know what's happening in Congress, is that in this new administration, they're trying very hard to tear down the Affordable Care Act, which has provided access for so many Floridians for health care. Almost 9 million Floridians have access to health care insurance now because of the Affordable Care Act. There are only 20, isn't that wonderful? Yes, and there's only, 22 million people in the state of Florida, so it's almost half of Floridians now have health care because of the Affordable Care Act. And as we know, there have been announcements about tearing that apart and defunding Planned Parenthood. And again, we're not going back. We're not going to let that happen. And so we're going to create this army of supporters tonight, and we're going to stand strong together as we continue to support what we do for women and families in this state and in this great country of ours. And tonight we have a very special guest, a colleague of ours, who is with us and at a very special time, because we have tomorrow, March 10th, is the National Appreciation Day for abortion providers. And I will tell you that abortion providers, of course, and all of our health care workers and professionals in our health centers are our heroes, really, because they keep the doors open and access for women for reproductive health care. And I am so pleased to have Dr. Willie Parker with us, who is an esteemed colleague, an OBGYN, and is renowned for his work in the Deep South, taking care of poor women in Alabama and Mississippi. And I'm going to let him tell a little bit about his story, and he'll be speaking later on in the program tonight. So, Dr. Parker, so good to have you with us.
Thank you so much. Thank you, Barbara, for that warm introduction. And I had no say in trying to follow her. You just heard the Serena Williams of CEOs and Planned Parenthood. And you don't beat Serena Williams. You just try to stay on the court. So I'm grateful to have that generous and warm introduction. I'm grateful to be here to stand with Planned Parenthood. As a former medical director of Planned Parenthood DC, I've intentionally positioned myself outside of all of the major organizations so that I can work seamlessly with them. And there's no organization that stands for what I stand for that I enjoy working with more than Planned Parenthood. when I think about where we are in this moment, this would be considered an all-hands-on-deck moment when we look at what we face with regard to the effort to roll the clock back. You know, the mantra that that POTUS 45 rolled into the White House was, "Let's make America great again." But in order to long for that, you have to have a little bit of nostalgia and selective memory. Because I define nostalgia as when you remember things better than they actually were. Right? And so when you talk about the good old days, for some of us, the good old days weren't quite so good. For women who were pregnant in times where they were forced to go into group homes forced to give birth and to have their children taken from them. For women who lost their fertility or who even lost their lives simply trying to control their reproduction. For people to long to go back to those days is to have selective memory. But we're at a time where I grew up in the South, and listening to the older mothers, when I spent a lot of time, when there would be a civil rights setback and people were exasperated, the older women in my community would say, "Baby, in times like these, it's always been times like these." Which is to say, there's never been a time where those people who are committed to justice haven't had to battle and to fight for it. Because A. Philip Randolph said that freedom is never given, it is won. Right? And so we have won a significant degree of health and dignity and freedom for women with all of the advances that we've made. And I think it's quite fitting at this point in time that we draw the line in the sand and say that we won't go back. So they say that experience is not what happens to you. Experience is what you do with what happens to you. In the election, we saw oranges and we got lemons. Yeah. Right? So the question is, do we have the creativity and the courage to make lemonade? Because it requires us to look and to see something redemptive in the situation that we're in. Because if you think a little bit about oranges and lemons, they're both fruit and they both contain vitamin C, and vitamin T can provide nourishment for you. But you gotta know that there's vitamin C in a lemon just like it is in an orange. And so that is to say that in this moment and in this time, there's an opportunity here. If we're only smart enough and courageous enough to look for it and courageous enough to pursue it. So if you are, I think you're amongst those 700 people in this area who are in for the long haul. And so, while it's our right to remain silent, I don't recommend it. So stand with me.
Ever since the inauguration, there have been massive groups of people who have been organizing to push back, and Planned Parenthood certainly is among those organizations that are pushing back. We have over 10 million people on our online activation system in order to have their voices be heard, and it's going to take talking to each of our legislators, one congressperson at a time, and in our case here in Sarasota, it's Congressman Vern Buchanan, who is actually on the Energy Select Committee that is hearing the Affordable Care Act legislation this week. And so this is a community that supports women's reproductive health care. 70% of the people in America support funding for Planned Parenthood through the federal government. And as you said, that is Medicaid funding. That is funding that is fee-for-service. The federal government doesn't give us a blank check. They provide reimbursement for every patient we see. Just like you all have insurance and you go to the doctors, your doctor takes your insurance, Medicaid provides funding. So we know that those 70% of Americans who support funding Planned Parenthood are having their voices be heard, and we're going to continue to fight in order to make that happen. Well, we are certainly, as a responsible organization, looking at all of our options and working with our board in order to get ready for that. And we have the generosity of donors to assist us as well. But we are not going to accept that. We are moving forward to fight to make sure that all women in this country have access to reproductive health care, because this is about prevention. And Planned Parenthood does more to prevent the need for abortion than any group in the country. And to defund Planned Parenthood is un-American. So whenever you look at what's happening in America, if we want everybody to have an equal chance at the table, women absolutely have to have a human right to control their own destiny. And that's what this is about. As Dr. Parker said, we're talking about civil rights, women's rights are human rights, and we're going to stand to make sure that that happens.
We won't go back!
Well, I think the harsh reality is this is a bait and switch. Planned Parenthood, as a participant in Medicaid funding, they are a major stabilizer of the safety net. This is a ceremonial cut. The notion that if you defund Parenthood under some notion of fungibility, if Planned Parenthood, if you cut the head off, the snake will die. And so there's this notion that if you defund Planned Parenthood in the minds of the public, you're going to stop abortions. Well, Planned Parenthood doesn't get reimbursed for abortions, and Planned Parenthood will continue its mission of providing abortion care. And it will do as much as it can to provide well women care, pap smears, STI screening, all of the things that aren't accessible, especially in rural areas, because Planned Parenthood plays a critical role in places where there are no other points of access. So it's going to be the effort to kind of illuminate the harm and to force the people who are responsible for the public's health to come clean about the fact that they don't really have a means to take up the slack for what's going to happen when they exclude Planned Parenthood from playing a vital role. Well, there's just in general, as Barbara said, most of us embrace the notion that an ounce of prevention is worth a pound of cure. When people have good information and when they have access to evidence-based contraception, preventive services, even just getting cholesterol screening and all the other things, all of the other determinants of health, those are the things that Planned Parenthood provides as a primary care provider. So, it's, when you hear Planned Parenthood, the brand is abortion, 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 but as you often hear, even though people don't want to believe it, the majority of what Planned Parenthood provides is primary care. So look at your local community health center and what you value about that, that's what you should value about Planned Parenthood.
Absolutely. So we're going to take one more question because we don't want to give our whole speech away tonight, do we? So the question was, what do we say to patients who rely on Planned Parenthood? Patients are coming to us because they're very concerned and they want to make sure that their health care stays accessible. And so we talk to them about, what's happening in the world and what's happening in their area, encourage them to get engaged if they would like to. One of the things about Planned Parenthood is not do we only empower people about education on sexuality, but we empower people with knowledge about their rights. And their rights as a citizen in the state of Florida, their rights as a voter. And so we are working with people to spread the information about the potential defunding of Planned Parenthood. But we want people to know that our doors have stayed open no matter what. When we were defunded last year by the legislature, our doors stayed open no matter what. When people come to protest against us, our doors stay open no matter what. The day after the inauguration, our doors were open no matter what. We have been in existence here in Sarasota for 50 years, and we plan to continue to stay here no matter what. We're not going back, right, Shirley?